Hi everyone, for this video I'm going to be talking about atrial fibrillation, also known as AFib. And to understand what AFib is, it's important to first understand how the heart normally functions. So I'm sure you all know, but I'm going to give you a quick overview of how the heart normally functions. So in a normally functioning heart, the SA node, also known as the pacemaker of the heart, sends out an electrical impulse that travels through the walls of the atria and causes the atria to contract, and then this contraction forces blood into the ventricles. The heart's electrical system controls the rate and rhythm of the heartbeat. So now that we know how the heart should normally function, what is atrial fibrillation? AFib is an arrhythmia in which the heart's electrical signals are highly disorganized, causing the upper chambers, called the atria, to contract ineffectively, and this causes an irregular heart rate and rhythm. In AFib, the rate is much faster than normal, and it's always irregular, which is important to note. The atria are contracting at 400 to 600 beats per minute. So how can AFib be detected and diagnosed? Typically, it can be detected by an ECG, so these are the electrodes that are placed on the skin to measure and record the electrical activity of the heart in wavelengths. It's painless and takes only a few minutes. The signs and symptoms for AFib include rapid and irregular heartbeat, dizziness, shortness of breath and anxiety, fatigue, fluttering or thumping in the chest. And the risk factors for AFib include age over 65, family history of stroke, family history of heart disease, alcohol use, drug use, smoking, and high blood pressure. Now that we know what AFib is, the signs and symptoms, and the risk factors, I will be talking about how AFib is treated. So some medications that can be used to treat AFib include antiarrhythmics. So these may be prescribed to suppress the abnormal rhythm and to restore normal rhythm and conduction. And a few of these antiarrhythmics include amiodarone, procainamide, and sotalol, as we learned in class. Next would be beta blockers, and these may be prescribed for rate control. And then also anticoagulants may be prescribed to prevent thromboembolism and stroke. Some non-surgical procedures that can be done for AFib include cardioversion, so this is an electric shock that may be administered to convert the heart back to a normal rhythm using electricity. And then also ablation, so this is a catheter that's used to scar the area of the heart where extra electrical activity is occurring. And then finally, some surgical procedures that can be done include a pacemaker, so this can be implanted to control the heart rhythm with electrical signals. And also open heart maze surgery may be performed to stop disorganized electrical signals. So the last thing I want to talk to you guys about are the dangers of AFib, so what can happen as a result of untreated AFib. The first would be blood clots. So AFib affects the normal blood flow through the heart, which can cause blood to pool in the atrium, and this pooling of blood can cause a blood clot. When these clots dislodge, they then become a thromboembolism and can cause a stroke, so it's really dangerous. And that brings me to our second danger of AFib, which is stroke. AFib is a major cause of stroke, accounting for up to 125,000 strokes annually in the US. Approximately 40% of all strokes in patients 80 years and older are associated with AFib, so that's an interesting statistic for you guys. And the last danger of AFib that I want to talk about is heart failure. Heart failure is actually both a risk factor and a consequence of AFib, as I mentioned earlier. AFib can lead to heart failure because the heart is beating so fast that it never properly fills up with blood to pump out to the rest of the body. As a result, blood backs up in the pulmonary veins and causes symptoms such as fatigue, shortness of breath. So that's what makes AFib so dangerous. It can cause blood clots, strokes, and heart failure, all of which can be deadly. And the last thing I want to mention are some recommendations for a patient with AFib. So now, given what we know about it, what can we recommend for a patient that has AFib? The first would be to monitor their heart rate and rhythm. As I mentioned, the heart rate's going to be fast, the rhythm is going to be irregular, so it's important for them to monitor that. Also monitor for signs of stroke and blood clots. So it's important for not only the patient to be able to recognize signs of a stroke, but also the patient's friends and family to be able to recognize that as well. So they should know the signs and symptoms of a stroke and blood clots. And then lastly, this patient should adhere to their meds. So as I mentioned, anticoagulants are important to decrease the risk of blood clots. Beta blockers are important to control their heart rate, and then also antiarrhythmics to restore normal rhythm and conduction, as I mentioned previously. So thank you so much for watching, and I hope you learned something about AFib.